Welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Herkel, Melinda Crinan-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Also want to give a shout out to they joined our Concussion Fix Wall of Fame this week. They went from 94 out of 132 down to 9 in only 3 months.
Wow.
So really want to give a big shout out to Alex for that.
Here you go, Alex.
Good work. Good work. Okay, next up is
In August of 2021, I had a small meningioma. I've got a bad voice too today. A small meningioma that was treated with gamma radiation, and it has never grown. I'm checked every year. Yesterday, for the first time, because I'm still working through the program in a very early stage, I was told that my recovery will most likely be delayed or sustained because I'd had previous treatment to this meningioma, which I was told at the time by a neurologist some 4 or 5 years ago now, that, it was nothing. We radiated, it stopped growing, it's no big deal, just get on with your life. So yesterday, a link was made to my symptoms, which have been, by the way, decreasing in a matter of weeks. Having been with this program, I'm so grateful for it. Mainly my perspective has changed, but my perspective got a bit of a whack on the head yesterday. I'm wondering if there's any evidence that's available based on what I've just said.
So it really depends on if anything else may have been damaged in the process. Where was it? Do you know?
Yes, it was on the lower left side of the brain.
Lower left side. You know what lobe or?
At the moment, I can't tell you which lobe. No.
Because if you had like a MRI report or something like that, because generally with things like that, there's going to be very specific symptoms that may come of that, right? Like if it's in the language processing area, you may have difficulty with, word retrieval, certain things like that. It wouldn't be necessarily like widespread symptoms, but there can be more specific symptoms in the area that this was located. So yeah, it's hard to say exactly. But generally the symptoms wouldn't be like general post-concussion type symptoms. They'd be more specific.
I'm happy to hear you say that because I recovered fully from it. It was in 2021. I recovered fully. There was some swelling at the time. But yesterday, because my symptoms have gone on for 6 months, although I just said they're improving, I was told, well, this radiation is probably delaying your healing and may actually sustain your symptoms. It was a bit of a setback to hear that.
Yeah. I mean, anytime there's going to be any type of intervention, like we've heard, there was somebody posted in the news feed yesterday, even just going under a general anesthesia for a procedure, really set them back. So anything that's going to be more kind of systemic. Now, usually when they do radiation, that's very focal,
Yes, it
right?
was.
They're not irradiating everything. They're pointing things directly at the area, but there's going to be potential for some, we'll call it cross contamination.
It was gamma knife.
Right. So they are generally pretty specific with that. Now, certain things can come from that, right? Like you mentioned, swelling, there's going to be potentially some inflammatory reactions and just general inflammation just based on gut-brain axis. There could be some additional inflammatory results as, from that. So, yes, it could potentially make things a little bit more difficult, but I don't think that it makes it impossible in any way. And again, it depends on what the symptoms are and where the area was, and then maybe you could point to specific deficits that are lingering as a result of that. Um, but just as like a general kind of, PCS symptoms are very non-specific. There's a whole constellation of things, and there's a whole bunch of things that impact those symptoms. So if you had specific symptoms based on the area where this was located and the treatment was located, right? Temporal lobe, you're going to have certain symptoms. Frontal lobe, you're going to have certain symptoms. So it's hard to say whether or not it impacts it in any way, but um, the concussion side of things is due to other disruptions, right?
Right.
Inflammation, autonomic, but any type of stressor, like even finding out that you have this and having to go through the stress of this and having to go through the treatment of this is going to impact autonomic. It's going to impact potentially inflammation. It's going to impact mental health. And all of those can increase concussion type symptoms. And
Even though it
so,
was 4 years ago.
yeah, was this prior to was was this before the concussion injury or
Oh, yes, the concussion happened last September.
right?
This was an incidental discovery,
Yeah,
and it
usually
was
it is.
monitored for years. And then in 2021, they said it's growing and let's radiate it.
Right.
And from my point of view, until I had the concussion, I've experienced no setbacks of any kind or any
Right.
changes, and I
Right.
had none going in either.
Right. Right.
So the
So that
news
tells
yesterday was shocking.
yeah, so that tells me that it's more likely that the symptoms you're currently experiencing have nothing to do with this previous issue.
Me too, I
And
think.
so to me, I don't think it'll have any bearing, right? If it happened after, right? Like if concussion happened previously and then this happened, then it's like, okay, that could complicate things. But the fact that this was done, you had no symptoms beyond that, right? If this particular situation was causing you symptoms, you would have been experiencing prior to the concussion,
Exactly.
right?
So
So
I
that,
was so shocking to hear that
yeah,
yesterday.
so I disagree with that, just from where I'm sitting from a concussion perspective. Uh,
Yeah. I would
yeah,
just add to that, it's the specialist due diligence to report that potential. And I find sometimes that can be like a real mental shift for people when they're experiencing setbacks with something unrelated to it. So I find, maybe they're required to disclose that typically right after the original procedure. But when it does come up, that's just something that they're required to. It's just like when you read the risk factors on like medication and it says 1 in 1,000 chance of having A, B, or C. So I think, take that with a grain of salt. I'm hearing
Thank you.
that it really impacted your perspective on recovery. So it might just be, hey, can I put that on the back burner? It's just one person's opinion. There isn't really any secure evidence to say this is 100% factual and true. And you just started the program. So there's so much more to sort of go through.
Exactly. Thank you for that. Consider it
Yeah.
on the back burner.
Like it's sort of like, okay, here's a piece of information. It comes from a specialist. So usually if it comes from a specialist, people pay attention and they get really worried about it. But it's also, part of their job to say what the statistics are, potential risks, but it doesn't always mean that's 100% accurate and true. And so, maybe if you've gone through the program and it's been 2 years and we're talking about other things, it still could be, well, maybe, but maybe not. And I know Dr. Cam, you always say, well, regardless, here we are, right? And so how do we move forward and support you the best we can with, the information and skills that you can learn here from the program?
Thank you. My own sense was that it was completely a disconnect because, to hear that 4 or 5 years later, doesn't make any sense to me.
Yeah, no, I agree. I agree with your line of thinking here, just because if it was causing problems, the problems would have been experienced prior to the injury. And the fact is they weren't. So to me, it just seems like what you're dealing with is just, standard PCS that is unrelated to this particular condition. Now, the thing is, what a lot of medical professionals do, and I think this is one of the big downfalls of kind of the way physicians approach a lot of these things, is that they tend to fill our heads with what we call nocebos, right? So we've heard of placebo, and I've talked about this a number of times, but because we have some new members, I'll mention it again. A placebo is when somebody gets a positive benefit from something that actually doesn't have any therapeutic benefit, right? So if we're going to do a drug trial, we have to involve a placebo control arm because we have to figure out, is it actually the drug doing this or the expectation of the drug doing this? So what you do is you separate the group in half, you blind everybody. So the doctor giving you the pill, as well as the person getting the pill, doesn't know which pill they're getting. Are they getting the actual therapeutic or are they getting a sugar pill that has no therapeutic benefit whatsoever? And then they look at the results. So if we're studying a blood pressure medication, we're going to give both groups the handout that says, here's the potential benefits of this drug, and here's the potential side effects. And what you see is that even people in the placebo group will start to experience, even though they're not getting that medication, they'll actually get a drop in blood pressure, right? And then what they have to do at the end is say, what was the drop in blood pressure in the placebo group? And was the group getting the therapeutic significantly better than the group getting the therapeutic? Because if those two groups are the same and they both get better to the same degree, well, then we know that it's basically just placebo and the drug isn't doing anything actually, biologically. It's just the placebo impact of thinking that the drug you're getting may be impacting your blood pressure. And that's why the body and mind is so powerful, is because you can actually cause a drop in blood pressure by getting a medication that doesn't even do anything, but yet you're experiencing the positive benefits. But at the same token, what you'll see is people in the placebo group will also experience the negative side effects of the drug they're not taking. So that's
an amazing thing.
So that's called a nocebo. So if the expectation, if you're reading that list of side effects, and then you go, ooh, I hope that doesn't happen to me, and then all of a sudden you start experiencing some weird things, you're going to attribute it to this medication. Oh yeah, this blood pressure medication is making my, these symptoms appear, even though that you're taking a sugar pill, there's nothing in there that could do that, but yet your mind will start to manifest those symptoms. So that's a nocebo. So what happens a lot of time in medicine is that doctors will say things that have no real bearing in evidence, meaning like, oh, you're likely to have an protracted recovery because of this. So it alleviates the expectation on them to help get you better because they can just attribute it to this other pre-existing condition, right? So they can just say, well, you're not getting better, but that's expected because of this. And so it takes the pressure off them. But also what it does is it puts that into your mind now, where now there's a nocebo where you're thinking like, well, now I can't get better because of this pre-existing condition. And so that's really kind of a negative thing. Like the amount of stories you hear of people saying like, doctors telling people you have X amount of years to live or months to live, and then they live for another 10 years, or you'll never walk again, and people are walking normally. Like, I don't know why they tell people this stuff, because it's kind of a nocebo effect that puts into people's minds and potentially impacts their ability to recover. So that's the big thing with what we're trying to do with this program, is give people the truth. What does the actual evidence say? Is concussion treatable? Yes, it is. But the amount of people that will comment on my Facebook posts and say, you can't treat concussion, it's permanent, my doctor told me so. Okay, well, that's a nocebo. That is not true. The evidence strongly disagrees with that. Yet people will go to a neurologist and they'll say, well, if it's been 2 years, that's as good as it's going to get. There's no evidence to say that. There is zero evidence to suggest that's true. But that's a
They do
nocebo.
say it.
That I know they say it. But again, I think what that does is it alleviates the expectation on them, because if you're a neurologist, let's say, and you keep seeing the same patient over and over again, and you don't really have any tools, and you're not really that familiar with concussion and all of the latest evidence, you just say things like that because you want that patient gone. Like, stop bothering me. This is as good as it's going to get. Bye. I don't want to deal with you anymore. And so they kind of dismiss you in that way. But the problem is the patient then obviously internalizes that and thinks there's nothing that can be done, right? But it's that doctor that can't do anything for you anymore, or you've kind of exceeded their limit. But then they put it back on you to say, well, that's as good as it's going to get. Just leave me alone. And I think that's a huge, huge problem, especially if somebody's not super familiar with concussion and how it works.
I so wish that wasn't the case. Isn't that the most like disheartening thing when we talk
it's
about this?
really frustrating. It's really
Yeah.
frustrating from my perspective, like living and breathing this and literally reading everything on concussion that comes out that's published in the literature and kind of breaking it all down and realizing like, okay, this is completely treatable. We're not even dealing with brain injury anymore. We're dealing with other issues. And then, but like I was talking to Nikki yesterday, and I'm like, I firmly believe that if everyone with PCS took this program, it would eliminate so much suffering that's just unnecessary, because people need to realize that they're not dealing with permanent brain injury anymore. They're dealing with dysfunction that's easily treatable. Well, it's not easy. It's kind of a simple process. It takes a lot of work, and it's obviously very difficult. It's going to be the hardest thing you ever do. But you can do it as long as you follow the steps and kind of do the things that need to be done. So yeah, like I just wish that everyone with PCS would do this and just understand what's going on, just to change their perspective on things, to realize like this is not the end of it. This is not a permanent situation. This can be addressed, and we can do this in a very kind of step-by-step way. Anyway, that's my rant.
You're talking about the biology of belief. Greg Braden's work on that belief system. So if you believe what I hear you saying, if you believe what this doctor said to you is true, then there we go.
Yeah.
Thank you so much.
Yeah, if you believe, like you see this all the time in people with, extreme diagnoses like cancer diagnoses, things like that. If they internalize that like, okay, this is the end, and they kind of just give up. But then you have the others that are just like, no, I never took that seriously. Like I was like, I can do all these things and whatever. And then they have these great outcomes. So it's like, how much of that mental health and that resiliency of an individual goes into your ability to recover. And we see this throughout the concussion literature too. One of the number one kind of elements of who will have persistent symptoms, and obviously this isn't everyone, this is just kind of like, there's a bunch of criteria here, but one of the number one is your kind of coping style. Right? Are you kind of a resilient individual that, will say, I'm going to do all these things, and I'm going to get better from this, and I'm going to do that stuff, and I'm going to optimize this recovery? Or are you somebody that just says like, well, I'm more of the victim, and I'm going to pull back, and I'm going to avoid everything, so it really comes down to that.
You guys are describing the recovery mindset module.
I know, that's what it is. That's why it's first. That's why it's first. And unfortunately, it's the one that most people, skip over. They're like, no, that's not me. That's not me. But it's so important to just understand how powerful your mind is. If I can give you a sugar pill that you think might lower your blood pressure, and your body physiologically lowers its blood pressure,
the power of belief
that is just so incredible. The fact that you can manifest side effects of a drug you're not even taking. We have to understand how powerful the mind is in terms of every single condition.
Yeah, in your favor and not in your favor, right? In your favor and not in your favor.
Yes, it goes both ways. It goes both ways, right? Like if you think something's wrong, you will continue to see evidence that something is wrong.
Yeah.
Mind, and you think about neuroplasticity, those pathways become strengthened the more you use them. So if your mindset is constantly like something's wrong, something's wrong, something's wrong, guess what pathways are getting strengthened? The something's wrong pathway. And then that's just going to continue to show evidence and continue to strengthen that pathway. And we're developing neuroplasticity, but in the wrong direction. So what we need to do is, that's why we start with education, actually, is to get people to realize like, oh, this isn't brain damage. This doesn't mean this is permanent. And then potentially they start to strengthen pathways towards optimism and thinking things are okay. Well, it's a treatable thing. I can do this, right? And then we strengthen that pathway. And then we move on to mindset and we continue to strengthen that pathway. And that now the neuroplasticity is going in the right direction and not in the wrong direction.
Mhm.
Anyway,
Thank you so
I'm glad
much.
this came up. It's
yeah,
my
this
So,
is
favorite.
so am I. I'm a therapist by profession, and I got whacked on the head with that remark. I mean, I know better, but I didn't, because my
Mhm.
symptoms were so powerful that here was an
Yeah.
expert telling me, gee, it's just going to be this way for a long time. Too bad.
Yeah. And even, as an expert yourself as a therapist, often it's really hard to apply these
No
concepts to
kidding.
ourselves, right? It isn't something that's easy.
Yeah.
Every therapist needs a therapist or needs a support group, or, it's not normal to try to apply these things to ourselves because we need that listening ear or that guidance to kind of help
Well, I have a
support.
big smile on my face right now. Thank you
Yeah.
so much.
And this, I mean, we're going to move on to another question here, but this is another conversation that Nikki and I had yesterday. It's that doctors make the worst patients,
Mhm.
right? Because,
True.
we think we know better, and we're not looking at it from like an objective out. We're so internalized that it makes it more challenging sometimes. And oftentimes what we find is that the people that end up with persistent symptoms are often the very like high achieving professionals, because
believe you.
they're always thinking, they're always kind of, their mind is always thinking about what about this and what about that and what about this and what about that. And so it can be a barrier, right? Whereas the people that are more kind of like, whatever, those types, they tend to just recover fine, like nothing happened. But it's the really like high achieving professionals that, are just kind of go, go, go and always thinking and always on, that sometimes acts as a bit of a detriment.
Yeah, we did a live on that around perfectionism and the risk of PCS. There's actually a body of literature that talks about the connection. Anyone with sort of fixed mindset tendencies, so people who can get really fixated on I have to be this way or I have to be that way or everything has to resolve or else I, forget it. I'm not going to get back to my life. All these types of traits that are quite typical of like a type A personality tied with perfectionism. Some of it's more in the realm of like anxiety as well. It's all really important. So I'm glad we're talking about
Fabulous.
this today.
Thank you so much.
You're welcome.
Very appreciative.
Okay, next up is
Hi, how are you?
good. How are you?
Hello.
Good. Yeah, so I'll go from the start. I'll try to make it short. I was diagnosed with an arachnoid brain cyst after a concussion through martial arts, boxing, or sorry, Muay Thai. And a few years before this happened, I used to spar and was active. Never had any problems. Took a break, started back up when I was around 19, 20. I got a concussion from a very small hit, which weirded me out, but that's when the cyst was found. I went in again to sparring 2 weeks later, not knowing I actually was concussed. And it really blew up. So I had memory problems and I had really bad anxiety for like a year, just from stimuli. Um, Now, fast forward roughly 5, 6 years later, I got the brain cyst taken out in January of this year. And I stayed in the sport, not sparring, of course. But I ended up becoming a coach, but my dream is to get back in the ring as a competitor. Um, and the cyst being taken out, it relieved a lot of the head pressure, and funnily enough, it fixed a lot of my ADHD symptoms. Like I have a lot more mental quietness, you could call it. But um, my vision, um, feeling fatigue, ringing in my ears, that's still there. An example would be 2 weeks ago, I was instructing, and I always get blurry vision after a little bit. And I was showing the students how to hold a guard, and I told them I had surgery just 3, 4 months ago, so I can't take any hits, and especially with PCS. But when I'm all recovered, I'll be back. So go very light, and I'll show you what to do. So I put the gloves against my head. He barely tapped me. and it gave me symptoms for roughly 4 days, where I went back to some memory problems, a little bit emotional ups and downs, things like that. And it was the first time I was very confident that I wouldn't get symptoms, because in the past I've fallen into the mindset where, no, I'm just going to get symptoms. So they were milder this time, but they still happen. Then last part of the story, last week, I went to a physical therapist, because we don't have much where I live. I used to live in the US, but I had to move home to Norway due to the severity of my symptoms. I couldn't work anymore. It got pretty bad, but I'm working my way back. And I've been through a lot of, the Buffalo treadmill test and things like that, but I can't really go for long because my vision gets blurry. I see spots everywhere, like snow pretty much. Um, and this physical therapist gave me a massage. After that, I got up and I felt this rush through my head. And I couldn't see for like half a second. It got all white. Then I went out to the car and I noticed everything was extremely clear, like clearer than it had been in these 5 years I've been battling this. Then it went back to being worse and I got extremely light sensitive. And of course, with concussions, it gets worse before it gets better, right? I hope so, at least. So I'm just curious, I'm still working on the courses because I signed up just a few days ago. It's my first time here on the podcast. Um, do you have any suggestions or ideas how I should, get back to my sport, working, all of those things, start generating income again and get a normal life?
Yeah, I mean, so the symptoms that you're experiencing, right? So the cyst, generally those are there from birth. So this is something you've always had, right? So for the most part, I mean, sometimes they can develop, but for the most part, they're kind of congenital, meaning they're there. You get it removed, it relieves some of the head pressure, because some of the symptoms of this can be, increased pressure in the head or headaches and things like that. So you get it removed. Okay, so now you notice some changes. Now, the other symptoms that you're experiencing, like blurred vision and that type of stuff, or even visual snow. Visual snow can be related, and what it's often related to is just hyperarousal of the nervous system, right? So if your nervous system is very kind of on edge and like hyper stimulated, the same thing with light sensitivity, same thing with noise sensitivity, any type of sensitivity, pain sensitivity, right? People have like, oh, it's like it really hurts. I have a lot of tenderness in certain areas of my body and like a lot of pain, right? That's like hypersensitivity of the nervous system. And the same thing goes with those types of visual symptoms. Now, blurred vision can be a visual issue, but it also frequently is a neck issue. And that makes sense because the neck can cause mental fogginess, it can cause fatigue, it can cause headaches, it can cause vision problems, it can cause blurred vision, it can cause every single symptom that concussion causes can come from neck issues. You get treated, right? And probably when you stood up and had that like rush of like, whoa, that's autonomic, because it's like when you stand up from like lying down for a long time, it takes a while for your blood to get back to your head, right? So people will often feel like they're going to faint. That's an autonomic response, right? So there could be some orthostatic issues there. That's autonomic. And then when you're like, oh, I felt so clear, right? That's because the neck tells your vision what to do. All of a sudden it opens up the mental fogginess. The neck treatment had such a profound impact. You're like, okay, there's probably some neck issues here. Now, yes, it came back, but that probably just means that you probably need more treatment to kind of get it to stay where it is. Right. And then that's kind of the part where sometimes you can get worse before you get better, is you kind of have to deal with a little bit of discomfort as you go through that process. But then as things resolve, it's like the clarity starts to come back on. So how do you get back to everything you want to do? Well, the steps in this program are to work on all of those, right? So you will learn how to fix the autonomic nervous system. You will learn how to exercise properly without it impacting your vision like this, right? And a lot of it comes down to other things you can do to support the autonomic nervous system. Melinda's stuff is going to be very important for you to try and like learn how to regulate and calm the nervous system down. And as you go through this, more and more symptoms will start to go down and down and down. So, how do you get back to work and normal life? Well, first thing you got to do is like really do the steps to start alleviating those symptoms. That will increase your resilience to be able to tolerate more and more and more, which means you'll be able to do more and more, which means you may be able then to go back to work. When can you go back to sport? Well, because you're in a combat type sport, I would make sure that all of your symptoms are gone and you do a very gradual return to increasing more and more activity. The other thing I would point you to, and maybe Nikki, you can put it in the chat here, is the concussion cliff. So you got increased symptoms with just a light tap. That's not another concussion, right? But what it is that if you're really dysregulated, right? The idea is that you're standing on the edge of a cliff, right? If you're way back here and you get a concussion, you're only right here, right? So that's fine. You can kind of resolve that. But if you have all these other dysfunctions, you have previous concussion injuries, and now you're standing right here on the edge of the cliff, any little stressor that comes along, whether it be mental, physical, emotional, someone hits you slightly, you're going to fall off that cliff and all your symptoms are going to come back. That's not because there's another concussion or that your brain is fragile or anything like that. What it is that your autonomic system is dysregulated. You may have neck issues, and then any little impact is going to jar your neck a little bit, and then that's going to cause symptoms. You're also going to start to feel a little bit of anxiety of like, oh my God, I've done it again. That's going to cause symptoms. So it's all the other factors, right? That are you just have these dysfunctions, and any stressor that comes along is just going to push you over the cliff. So what I'd work on is getting yourself symptom free and back up here, but also keep working on that stuff to get yourself well away from the cliff so that if you do get hit again, you're not falling off the cliff. Your body's able to tolerate it because you've built up the resilience in those systems to be able to tolerate it. Does that make sense?
Yes, thank you so much.
Watch that cliff video that Nikki just posted, because I think that'll explain it a little bit better as to why the setbacks are occurring, right? And it's framed as little hits causing setbacks in this video, but it can be anything, right? It's like returning to work too fast, too soon. It's just stress on your body. And if you haven't built the tools yet to handle it, you're going to fall off the cliff. It could be a small hit. You haven't built the tools yet to handle it. Your neck is still unstable and you haven't done the work to stabilize it. Any little hit's going to dysfunction your neck again. And now you're back to square one and you have to kind of do that work. So that's why it's like, get yourself up to the top of the cliff by doing the things and then keep working on those things over time. Even when you're asymptomatic, keep working on that. Keep building the strength and stability in your neck so that when someone hits you, you're able to stabilize it and it's not going to cause that dysfunction that's going to cause those symptoms, right? So yes, it's entirely possible. Yes, you can get back into the sport that you love, but don't rush in now because then you're just pushing yourself off the cliff every time and you can't get any ground. So you need to be like cautious now, working on all those things, working on all those tools, getting yourself to a point of asymptomatic. Then you're going to start building up your tolerance for more and more cognitive based activity that you want to do for work and also physical to be able to tolerate the impacts you're going to get in sport. And then gradually and gradually and gradually, you're going to be able to do more and more and more. And then, okay, now you're ready.
Yeah, and give yourself time, right? This is a process. It's not like hey, tomorrow I'm going to be ready to go.
Yeah.
So sometimes just that mental game of giving yourself enough time. Can you give yourself 6 months? Can you give yourself a year? Whatever that is, typically won't take that long. For some people it does, but giving yourself a good chunk of time to say, hey, I'm just going to focus on this, right? And building yourself those four walls to sort of protect yourself from any hits at the moment. In order to be able to work through this. And it sounds like you're just starting the program, so everything's kind of in order for you as you start moving through.
Perfect.
Yeah.
Thank
I mean,
you.
the one thing we always say is like tortoise in the hare, right? Like slow in this is fast because the slower you go, the more you're building structure to get to a point of resiliency. The more you rush through being like, well, I want this done now. I want this done. I want to be able to do this next week. It's not enough time, and it adds more stress to the situation, which actually makes it harder for you. So if you're in a rush, it's actually going to take you longer. because you're going to go through your tortoise and the hare, right? The hare gets off to a great start, but then needs to rest because it overdid it. And then it gets off to, and then it overdid it and it has to rest, right? Slow and steady, tortoise and the hare. The tortoise just step by step, gradually, slowly but surely wins this race. And this is the concept. So be the tortoise, take it very slow, methodical. Don't set the timeline for a week from now, set it for a year from now. Hey, in a year from now, I want to be back to full contact sparring. I'm going to give myself an entire year, right? So now, what do I have to do in the meantime to get there? I'm just going to follow this step. And now I'm not in a rush. I'm just going to take my time. I'm going to build my structure strongly. And that is going to pay off dividends in the future. And that goes for everyone listening to this is like, fast is slow. Trying to rush through is going to slow you down. Take your time, do the steps, and you will actually start to accelerate because it seems slow at first, and then all of a sudden it'll start to kick up and you'll just be knocking it down.
Awesome. Thank you so much.
You're welcome. Okay, next up is
Hey, how's it going? So I had a question about an incident that happened on Tuesday. I mean, like you were just talking about, I've kind of fallen off the concussion cliff recently, and every little bump or hit to my head feels like a concussion. Um, am I able to turn my camera on for a sec? All right. So I was at the gym and I had my headphones on like this, talking to my friend. I had the one side lifted off, and when I was done talking to him, I kind of just let it go, and it like came back and hit me in the head. And I know that doesn't seem like much at all, but it kind of really got me worried and that it did something. And pretty stupidly, I did that on purpose about like 5 or 6 more times to try and convince myself that it didn't cause anything. And ultimately that just added to the anxiety and I couldn't convince myself. Um, so I guess I kind of came on here to get some reassurance, like, and ask you, do you think that would be able to cause a concussion?
no,
Okay.
not even close.
Yeah, okay. Um, so how come like the pressure in my head has been noticeably worse for the past couple days? Like why is that? Is that just my anxiety or
Yeah. Most most likely. So, there's a type of anxiety where people can do like repetitive behaviors too, right? So there's a type of anxiety where people say like, "Oh, I did something, it brought on anxiety. I need to try to convince myself that it's fine." So I don't know if that's relevant for you in other instances where you might repeat something a few times in order to sort of like try to convince yourself that everything's okay. But that's a type of anxiety. So that, points to a little bit of anxiety right away. And when we get anxious that we might have reconcussed, then what happens is our nervous system goes into that sympathetic drive, that fight or flight response. So our symptoms are likely to increase. So from what I'm hearing, that sounds like what's happened. And you just need to give yourself some time to down regulate that nervous system, whether that's, I'm not sure how far you are in the program, but some walking, some being out in nature, some deep breaths, humming, all of these things that are in the program help you to regulate your nervous system when you get overwhelmed, right? So even just mentally knowing that it's your nervous system that, got shifted into an upregulated state or that fight or flight response is just a sign, oh, okay, it's just my nervous system. It's not a concussion. But if my nervous system gets overactivated, I'm going to experience more PCS symptoms.
okay. I guess that's really all I had. Yeah, yeah. Thank you very much.
Yeah, you're welcome. I think and we've talked about this in your particular case, but I think that you know, getting a handle on that anxiety is like the top priority for
Yeah.
you. It's being
Mm-hmm.
able to you know, convince yourself that those small hits are not anything, right?
Yeah.
Like I can sit here and bang myself on the head.
Yeah.
That's not going to cause concussion, right? You need a massive amount of acceleration of the brain to cause a concussion injury,
Yeah,
right?
sure.
You're talking equivalency of a car accident, you know, going
Yeah.
50,
Yeah. But with
right?
the story of anxiety, right? Anxiety isn't logical. It's not, yeah, yeah. And oh, just in addition to what you're saying, because it's true, right? Those are the facts. And as a human being, we know that the facts are what matters. But anxiety has this different lens on things, right? Where it's just like not rational and it can't follow logic. So
Mhm.
it makes sense that you might have another part of you. You know, there's this logic part of you that totally understands what Dr. Cam's saying right now. And then there's another part of you that might just be like, but my anxiety tells me that like I need some kind of, something to convince me that everything is okay. So what I'm hearing is it might be really helpful to get treatment for anxiety, to help you build coping skills to support you through anxious moments so that logic does make a little bit more sense and that voice of anxiety isn't so loud. We do, of course, go through skills and techniques to support anxiety in the program. But if you're finding this is coming up often, it's most beneficial to get support from a mental health professional because they're going to be able to tailor those skills to specifically what you need. And as I mentioned earlier, there's different types of anxiety. So I can only be general in our psychoeducational program with the concussion fix. But if there's more specificity to the type of anxiety you have, or for anyone listening, it's helpful to have some guidance.
Sure. Yeah, and I was just gonna say, like situations like this have happened like probably like 15 to 20 times in the past year. And it's like it just doesn't make sense that I've had 15 concussions in a year. So
You
like,
haven't.
yeah. So and I saw a video of yours that it's like it's not the setback that matters, it's like how you respond to it. So planning on responding well to it, and yeah, keep working on the anxiety part.
Yeah, I mean, these aren't, and we say this all the time, these aren't things you can necessarily um, it- just start trying to do when you're in a dysregulated state, right? It's like you have to try and do the work ahead of time so that you have the skills so that when something comes up, you can go back to those skills. So this is something you have to like really work on even when you're not in a state of anxiety or panic about a certain situation. Because if you're only trying to do it when these things come up, you're not going to be very good at it. And because you're not very good at it, it's not going to be helpful in any way. So it's like these are things you really have to work on in the off times when things aren't, going bad. Because then when things go bad, you can call upon those skills to use. Um, and I know this has been a bit of a struggle for you. And and I know that I think you are in therapy. Is that correct?
Yep, I am.
Yeah. And have you tried medication?
I have not, no. I'm kind of against it a little
Hmm.
bit.
Yeah.
I just feel like I can get over this without medication, and yeah.
Yeah.
So,
Sometimes, and I think that's generally our approach. But sometimes if this is something you've been working on for a long time and you've really been putting the work in and you're still having these issues, sometimes medication can act as a really good bridge for people,
okay.
just to kind of calm things down. I know Melinda, you probably have some thoughts on that, but
Yeah, I mean, combination therapy is sort of what I recommend to people when they've exhausted psychotherapy treatment, and it's not effective. So I'm not sure how long you've been in therapy. But the other important thing when you're working with a therapist is that they have skills and expertise in the area of anxiety that you have. So making sure that, they understand repetitive behaviors. If I'm guessing if this happened with the headphones, that potentially this happens elsewhere as well when you feel anxious. Um, so that's important, right? That's more along the lines of what we call like OCD or obsessive compulsive disorder. Specific therapists will be more skilled in treating that than others. If you work with the therapist that just knows about generalized anxiety, their treatment approach may not be effective for more repetitive or, these OCD type behaviors. Of course, I don't know you in your case. I just picked up on that one little piece you shared.
Well,
But
you're right with that. So,
Okay. Yeah, and there's nothing wrong with that. What's helpful is getting the right support, right? And so some therapists just don't know about OCD, and I get this a lot because I work with OCD in my practice, and if you don't have a therapist that understands it or knows how to treat it, then it cannot be as effective. So I would say first, before considering combination therapy, maybe making sure that your therapist or the therapist you're working with is understanding of OCD and why you feel the need to do those repetitive behaviors.
Sure. Okay.
I hope that
Thank
helps.
you very much.
Welcome. Okay, next up is
Hey, can you hear me?
Yep.
So my question is kind of similar to things I've been asking the past couple of weeks I've been in this course. But so I'm dealing with like a lot of anxiety and ADHD basically. And that's like the biggest barrier I've had in doing the course and implementing things every day. So I just want to see if you or Melinda or whoever thinks that my game plan is like good. So I'm thinking that I'm just gonna go through like the mindfulness, the mindset module. And like while I'm doing that, I've been seeing a psychotherapist on Zoom. I don't know if that's like what you guys think about that. But so I've seen her like 2 times, and basically it's just like we talk and she gives me tips on how to like plan my days better and not get setbacks and stuff. So I'm doing basically the course at the same time as psychotherapy. And also like I don't know, when is that enough, I guess, like for ADHD, or should I be doing more? Because I asked you guys a couple weeks ago in a message, and I think Dr. Cameron Marshall, I think you said that I should wait till like a later point in the course to get like cognitive testing or whatever. So when would that be? And I don't know. So like, what do you think about that whole plan though?
I think it's a great plan.
Okay.
To just focus on, especially if there's a lot of anxiety component, and you've identified that for yourself, which is a huge first step, right? To even just acknowledge that that's playing a role. And I think a lot of people, kind of deny that fact even. So the fact that you're saying, okay, this is something, I think that's huge. And I think, going through the program and working on Melinda stuff in conjunction with a professional that's able to tailor it to your specific needs is probably the ideal situation, right?
Mhm.
And like I said, the reason we put that first is because it's the most important. And so if you really work to get a good handle on that first, it's going to really improve things for you moving forward through the rest of it. Because at some point in this course, we're going to get you to challenge yourself and push into things and do things that are uncomfortable. But if you don't have a good, strong foundation underneath you, then it could all crumble. So I think you're doing the exact right thing. In terms of cognitive piece, the reason why I suggest that you don't rush into that necessarily right away is because a lot of the cognitive symptoms that people experience are due to all of the other factors that we're going to address anyway. So, for example, one of the biggest drivers of cognitive difficulties is anxiety, right? So, if you go and get a cognitive test right now, if you have a heightened state of anxiety, your cognitive results are going to look poor. And then, so what does that mean? Well, the cognitive person is probably going to tell you to do cognitive rehab. And now you're adding this additional piece to the mix that may not even be necessary because you may not have true cognitive impairment. What you're really dealing with is an anxiety problem. And let's just focus our attention there. Other things that can cause cognitive issues are things like inflammation, right? Inflammation. And also a lot of ADHD symptoms can be related to diet and things like that we're doing, or lack of sleep and other things. So that once we address those kind of underlying issues, most of the time, cognitive problems go away. And so you don't even need the cognitive assessment anyway. So rather than rushing into the cognitive assessment and trying to kind of do everything simultaneously, I think your approach is way better of just, I'm going to focus on this piece. I'm going to try and reduce my anxiety and really work on this foundational element. And then when I'm feeling good and my anxiety levels have lowered, Then I'm going to move on to the next piece, which is conquering inflammation and regulating my nervous system. And then that's going to knock a bunch off. Your clarity is going to improve. Your focus and attention will be able to improve. And so I think it's the right approach. Just do exactly what you're doing. Don't worry necessarily about getting further assessments and all this other stuff, because I think that as you go through this and implement those things, all of that stuff will kind of wash away naturally.
It's hard to be patient, right? It's hard to kind of just focus on one thing, especially, my modules. And whenever, if you've come to the Tuesday lives with me, we always talk about this. Oh, it's so hard to get through Melinda's module. I don't want to think about the things that aren't working for me in my mindset. I don't want to talk about my anxiety. It makes sense, right? That's the hard stuff. And we put it right at the beginning, obviously for a reason, but it is challenging. And so getting support to get through that part of the program is so important. And maybe just normalizing that it's okay to stay there for a while.
It's definitely okay to stay there.
Sorry. Can I ask a second question about that?
Yeah.
So do you think it's not like for cognitive testing? I've never actually been diagnosed with ADHD. Do you think it would be any value of like actually getting tested for that or not really? Because I think I definitely have it. And if I don't, I have something else. But
yeah. And you may, but again, I think it's going to cloud the diagnostic picture if you're trying to get tested for something while you have all this other stuff going on.
Yeah.
You know what I mean? So I would try to let's just work on getting a handle on these like physiologic things, because you may realize at the end that, oh, this part of it is actually quite mild or manageable. Or if you still feel that, yeah, there is some kind of ADHD type tendencies here after I've done all these things, yeah, then for sure go and get assessment for it, and that can be helpful. I just wouldn't necessarily, rush into it. But I don't know, Melinda, maybe you have a different thought on that.
No, I like the plan. I know it's challenging. I think that if you have someone right now that's supporting you to get through the program, that's going to be supportive for your ADHD because you have some accountability, whether or not you have ADHD, but if you think you do and you're getting someone to help you with accountability to get through the program, that's enough for right now, right? I mean, it's difficult to make a specific call, but I would say if you can work on the anxiety, and how much that impacts your nervous system, that perhaps takes precedence over figuring out the ADHD component. Unless you find that with the assistance of the therapist, you still can't make any progress in the course, then maybe you do need to pause and work on the ADHD component first. Because if you can't get through the program at all, then it's going to be most helpful to go that route. So figuring out whether this works with your therapist supporting you, that's going to provide you with accountability, encouragements, maybe some clarification on some of the things that we talk about in the program, and see how it goes. And if you're starting to make progress through the first few modules, then stick with it, keep going, right? And not worrying about what's coming next just yet.
Do you think that taking Adderall or something right now would help though? Or do you think that would be a later problem also?
I mean, we can't advise on medications for any, whether it's a mental health or physical health conditions. I can't comment on that.
Yeah.
You could ask your therapist, or your family doctor. However, it's always a little bit of a trial and error. So if you're already going forward with the program with a therapist, see if that's working. Or maybe you're asking this today because it's not working. And in that case, maybe it's helpful to go back and figure out the ADHD piece first. We did do a live on it. I think you've already listened to it. Sometimes people will use the live that I did on ADHD to try to figure out whether or not they identify with the diagnostic criteria for ADHD. And if they do, after listening to the live, sometimes people will go and seek that as like a diagnostic criteria and actually go get an assessment done. But it's not necessary unless you find you're not making any progress with the current setup that you have.
Okay.
Yeah, there was just a recent study actually on like Ritalin in concussion patients, and there is benefit to people.
Yeah.
but there's
You'd want to get a
also
diagnosis first and then see.
yeah, but there's also potential side effects, right? Like it's a stimulant, it could impact other factors. So you just kind of want to proceed cautiously generally with medication. That's usually our approach is like, let's let's fix the systems, you know, first. But if we're still struggling, then okay, maybe it's worthwhile adding something to the mix, right? Like from a therapy perspective, you've only had 2 sessions, right? Generally, it takes a little bit longer than 2 sessions to have a noticeable improvement. So
Yeah.
I think your plan is great. Mindset modules, working on the tools, getting the support from the therapist, really trying to like hone in on that particular item, I think will be really, really beneficial. And then as you move through, you might notice that a lot of these symptoms that you're experiencing are starting to kind of wave off and you don't even need to go that direction, right? But you also may come up against something where you're like, I've worked on this a lot and it's still there. Okay, now maybe we can look at alternatives and getting some additional support for that. But I think that if you're able to kind of stick on this plan that you have, I think that's probably a great first step.
Yeah, and research shows that effectiveness in therapy comes between 3 and 5 sessions. So I would give it the full 5 sessions and then see how you're doing.
Okay. Thank you.
Great. Do we have time there's one in the chat. I had an MRI 5 days ago, which was brutally loud despite hearing protection. And during one of the sequences, there was a thumping noise accompanied by vibration that felt like my head, which was wrapped tightly in coil, was being hammered. I now have bad tinnitus, hearing sensitivity, and I'm afraid I have lost hearing. I know that this can be a risk in MRIs. The hearing protection can only do so much and doesn't mitigate bone conduction of the sound. I was hoping that the hearing issue would improve over time, but I have no improvement so far. I also feel as if I have a whole new concussion. I've had previous MRIs of the other body parts and once my head, which were brutal but did not result in repercussions like this, except for maybe some temporary tinnitus, but I didn't remember any of them having a hammering sequence like this one. My main concern is hearing damage, as I have heard that that's happened with MRIs.
I mean, I can't really comment on whether or not there was hearing damage or not. What I would do is I would just give it a bit more time. And you can always go to see an audiologist to see is there actually, hearing loss here. A lot of what happens in MRI situations is that you're tightly wrapped, right? It's very claustrophobic. There's a lot of loud banging. Sometimes there's concern over what they might find. And so I think that if you have kind of, a little bit of anxiety about those things, and also you have a little bit of kind of fight flight, your nervous system just accentuates that. And now you go into just a greater state of fight flight. And then you start worrying now in the after effects. Oh, I feel like this gave me a whole new concussion. I feel like now my hearing is damaged. And now you start spinning and spiraling about all these other potential consequences. And that just makes things worse, right? It's kind of that, like what I talked about, we were, the stock market crash and like, okay, we have a slight setback here due to something, right? Which is maybe the stress of the MRI, being in a tight spot, loud banging, whatever it may be. But as we spiral, now we turn a 10% drop into a 50% drop because of our response to it. So there was a study recently, actually, that it was probably last month or the month before, that came out looking at MRIs and concussion recovery. There was speculation that maybe MRIs was prolonging concussion recovery for some respects. And they found that wasn't true at all. So the MRI isn't doing anything physiologically to create any damage to the brain. The loud banging will not give you a concussion injury. The pulsing magnetic fields will not do anything to disrupt brain recovery or concussion recovery. But I think what it is just a very stimulating environment that if you're already kind of on edge, is going to potentially push you over the edge of that concussion cliff again. And then now the repercussion is like, well, my hearing now. And so now you start to spiral even further. So what I would say is try to do whatever you can to just put your mind at ease that like the MRI can't do anything from a damage perspective. And just see how the hearing evolves. And if you notice that in a month or 2 months or 3 months that your hearing still is kind of off, then what I would do is I would try to tell your doctor, book in with an audiologist. They'll do a hearing test. They'll look at the levels, the different decibels that you can hear at, and they'll tell you whether or not there's some loss there. Now, is that a result of the MRI? Was that pre-existing? We wouldn't be able to really tell, but if, you're saying you can pinpoint it to that particular thing. So yeah, I think it's a lot of the anxiety and stimulation of getting the MRI that starts to trigger these kind of setbacks, but it's internal, right? Like it's the mindset piece, it's the autonomic, it's the fight or flight. So what
Yeah,
can
that
we
nervous
do?
system dysregulation.
What
right?
can we do to
It's huge.
reset that nervous system, right? We can do the breathing exercises. We can get out in nature. We can make sure our sleep is good. We can make sure our diet's good. We can make sure that we're working on all the mindset stuff from Melinda's section to try and just kind of calm things down, let things stabilize, and then we can just kind of pick back up where we were and go right back into it. I would just put the hearing thing aside for now because that just could be some temporary issue. Just leave that alone. There's nothing that you can do about it now because it's too soon. Just work on all the other pieces and kind of calming the system down. And then if it's still there in 2-3 months, go get your hearing assessed by an audiologist.
Yeah, oftentimes, if we go into a nervous system response following any kind of procedure, right? This is a really common thing, whether that's an MRI or something else. MRI is particularly aggravating because it is so loud and you're in like a little tube.
It's
So
tight.
it's very claustrophobic. So it's normal, right? Just normalize that you might have that upregulation in your nervous system going into that fight or flight or that sympathetic response. Alongside that, you're going to experience an increase in symptoms, whether those are new or typical PCS symptoms for yourself, and then work through, as Dr. Kim mentioned, those steps to help support you to downregulate or balance out your nervous system. So take the theory as my nervous system just got really heightened as a result of this experience. I need to do the things I know how from the program or other to support myself through a nervous system trigger, if you want to call it that. And then give yourself time, right? I mean, oftentimes anxiety will jump right to those worst case scenarios. I was actually just re-recording that part of our program yesterday around cognitive distortions, right? The black or white thinking, the catastrophic thoughts. Oh my gosh, I had an MRI. I lost my hearing, right? We can jump all the way to the conclusion, but that's what anxiety does, right? It says, oh my gosh, something's wrong. I'm trying to protect you. But sometimes it's just too quick to jump to conclusions. So seeing if you can kind of play it out for a couple weeks or a month, give yourself time to settle from that experience before jumping to, okay, is there hearing loss, etc.
I think that's a great spot to wrap this up.
See you later, everyone. Have a great day.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.